Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I am talking about pee and poop problems. And this is something that physical therapists can help you with. So let's start off first with, when is a child ready to potty train? There's a general trend now for children to learn to control their peeing and pooping earlier. Some preschools won't let children come if they're not potty trained, and it's a source of some pride when parents can get their child to be potty trained sooner. And I don't know that it's necessarily a good thing. Yeah, you have to remember that your sensory awareness of your bladder and your need to be able to pee begins around the first and second year of life. And really not until 3 do you have good voluntary control of the muscles that need to relax for you to be able to pee and poop with good control when you need to poop and pee. So that's something you need to think about. You need to be able to stand and to walk to be able to be potty trained. That doesn't mean that the kids who can't stand and walk can't potty train, but it's going to be a lot harder for them because it's really the weight of the body down through the body down into the pelvic floor that helps get that body, that pelvic floor, ready and prepared to be able to do potty training. You have to have the postural muscles to eat and breathe and sit to be able to potty train. You need the cognition to identify the importance and the need to go to the bathroom and the proper place to go to the bathroom. You have to have the gross motor skills to be able to walk to the bathroom. You have to have the fine motor skills to be able to undo the belt, undo the pants, to be able to pull up and down the pants. Those are all important things. You have to be able to be dry for at least 2 hours at a time, like during a nap, before you should even think about potty training. You have to think about that as a child, when you're first born, you pee 20 times a day. And that frequency decreases over time so that between your first and third year of age, that decreases to 11 times a day and continues to decrease until 4 to 6 times a day when you're 12 years of age. So you don't want to start too early because they're still peeing very frequently. When a kid is ready to be potty trained, they need to have words for pee and poop, urine or stool or whatever you want to call it. They need to have words for it. They have to pee a fair amount at any given time, not just a little bit, but a good amount, because that's going to give you an idea that they're able to hold urine in their bladder longer. They need to have bowel movements at a relatively predictable time so that you have a good clue of when it's going to happen. You need to have them be able to stay in one position for 2 to 5 minutes. Some kids are too busy running around. They're not going to sit for 2 to 5 minutes. If they're not ready to sit for 2 to 5 minutes, it's not time to potty train. They need to show an interest in other people going to the bathroom. If they're not interested in it, they're probably not ready. They need to give a physical sign or make sounds or words that they need to go pee. They need to grunt or something that say, oh, I need to go pee, so you know, or go to the bathroom so that you know it's time to take them. That helps a lot. If they need to have a desire for independence. Some kids are really dependent kids, and some kids are like, no, I can do that. No, I've got this. No, I do. Those kids are more ready. They need to have a pride in their accomplishments. They need to feel like, yeah, this is something I did. They can be proud. That kid is ready. And I think the other thing is just an understanding and a value of putting things where they belong. Meaning poop goes in the toilet, pee goes in the toilet, things go where they're supposed to go. You want them to make sure that they identify the need, that they need to go pee, and that they don't like being wet. And they need to be motivated to follow what a parent asks them to do. They need to be willing to follow directions. Some kids are not ready yet. And so if your kid is not ready to follow all of these things, it's important to wait a little bit longer to be able to work on potty training, because the research says that if you potty train too early, the children learn to hold their poop, and they hold their poop inappropriately or incorrect times, that they tend to be constipated. And if they're constipated, the research says that they're more likely to have bedwetting accidents and pee accidents during the day. I hope these are things that you think about before you consider potty training, and think about that that you don't really want to get all wrapped up in this race to whose kid can get potty trained first. Because I know that there is a lot of pressure societally to get potty trained, and certainly it helps you keep from going through so many diapers, but can be damaging for a child if they're not ready to potty train and you're working on it anyway. I hope this is helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.